Hello, Dadpuzzles listeners. Welcome back. So, have you ever felt like you're constantly juggling parenthood in a world that throws new challenges at you every day? Well, that's you're definitely not alone. Because that's why we have created Dadpuzzles because these challenges happen to us all the time. Today, as a guest, I'm sure she has, she'll relate what we are going through because she's a mother herself, and so please, you're the superhero for the parents. Can you please talk? Like introduce yourself. Dr. McGuinness.
Thank you so much for having me. I am so happy to be on a podcast that's being hosted by a father himself. It's
Right.
just, I think you might be in the minority. I certainly don't want to perpetuate any stereotypes, but
Right.
but boy, like as parents, we need all the help and resources we can get. So I completely applaud you for the
Hmm.
work that you're doing with this amazing podcast. I'm Dr. Sheilagh Maguiness. I'm a board certified pediatric dermatologist. I have an academic practice in Minneapolis. And I'm also, as you mentioned, mom to two tween boys.
Right.
And I am co founder of Strike Club, which is a skincare personal care brand
Hmm.
aimed at boys, to give them the tools they need to take care of their skin and start healthy hygiene habits early. So lots going on, busy life, full life. So happy to be here and talk through some really important issues with you.
Oh, fantastic! That is true, and thank you so much for really being here. So maybe we can start with just the issue of, just normalizing self care because this is like it's like almost a foreign thing nowadays. So we need to bring that back. Can you talk a little bit how we as parents can do better and how we can introduce this in our lives as a normal thing?
Absolutely. I think um, as parents, we look at our kids and there are so many different stages, right? And needs are changing throughout every age. And it's in that mid-childhood age where our kids are starting to want to be more independent, want to do things for themselves.
Mhm.
And their bodies are starting, even as early as 8, sometimes the changes that begin with puberty.
Right.
So I really like to kind of frame it as, of course, before those ages, we're helping them with their care. We're doing their baby bath or their toddler self-care, et cetera. But in that school time, that
Hmm.
childhood time of change, that's a great opportunity for us as parents to guide our kids, teach them how to take care of their bodies in a really healthy, positive way. And as a mom of two boys, I kind of saw that was a little bit missing. And I also saw it in my own clinical practice. On the
Hmm.
one hand,
Right.
we've got girls who I
Hmm.
think modeled by, their mothers, but also other influences that they might be,
Right.
exposed to on Instagram or where, social media in general. We've
Hmm.
got girls kind of n- really already ingrained and socialized to take good care of themselves, their skin. In fact, on the one hand, the girls might even be going too far. We've heard in the news lately this phenomenon of the Sephora baby, where girls are
Right.
heading to Sephora, spending tons of money buying products they don't really need, and even some that could be harmful to their skin barrier.
Hmm.
And yet, on the other side, there seems to be still persisting a little bit of stigma surrounding self care for boys.
Hmm.
And as a mom and a doctor, that was really the area that I was like, I think that we can do better here. We can
Hmm.
start these conversations early. We can normalize. Acne is normal. What your body is going through, these changes for puberty is normal. Let's talk about what we went through
Hmm.
and then also give the boys too a voice and tools to
Right.
to engage in these practices and love themselves and take care of themselves and take care of themselves in a healthy, positive way. And that's really where Strike Club was born, I guess, out of
Hmm.
this desire to do better for boys.
Oh, that's amazing. And so this, so you tailor that towards them, and and also with the different age groups. Is there a way we can pay attention to the different age groups? How we take care of them in terms, like addressing the issue with the self care.
I mean, absolutely. So taking care of your skin starts as a baby, right? The
Right.
moms and dads and
Hmm.
caregivers are regularly bathing their children,
Hmm.
applying maybe a bland hypoallergenic moisturizer to trap water in and keep that
Right.
skin barrier really healthy,
Hmm.
especially if babies, are prone to dryness or eczema. That's really an important thing to do, the bathing, the moisturizing. That's also in the newborn and infant period a really nice bonding time for
Hmm.
parents, that skincare and the massage and the close time that you can get from doing that. And then of
Okay.
course we move into toddler years and we might start to get a little pushback on not
Right.
wanting to do a bath, but
Hmm.
making it fun, having the toys there, again,
The
providing them
bubbles.
with gentle things.
Hmm.
I prefer, really plain products and it for
Hmm.
kids, like fragrance free, hypoallergenic is what you're going to be recommended for me, because so much of what's out there,
Hmm.
marketed for babies and toddlers, in terms of skincare products are really harsh. They contain really harsh soaps, fragrances that may, cause rashes or allergies,
Hmm.
and different ingredients like really intense botanical extracts. There's been this movement, I think, for natural products, but
Hmm.
sometimes natural is not always better. So
Hmm.
keeping things really plain in those early days is really important for healthy skin and keeping it free of rashes like
Hmm.
eczema. And then as we move into the school years,
Right.
middle, like childhood, school age kids, they're
Right.
starting to want to do exactly what we talked about, take autonomy, and
Right.
then showing them how to take a shower or how to bathe properly. What areas should we focus on with bathing and washing? And
Hmm.
really kind of setting the stage and asking the questions. Because I think sometimes we send them off into the bathroom and as parents, like you actually don't know what's going on in there. You
Right. Right.
don't know what they might be using. You don't know what, how
Hmm.
they're doing things, and
Hmm.
unless you ask and provide that guidance, you
Right.
won't know. And you might be surprised to find out that your tween or teen boy is actually using shampoo, Pantene, head to toe
Hmm.
to
Oh,
wash, their body, which
right.
probably not the best, choice in
Absolutely.
terms of
Hmm.
being gentle on skin with all of
Hmm.
the, foaming and potential for reactions. So
Hmm.
it's a great, way to think about skincare for babies
Hmm.
in stages and
Okay.
different ages, and knowing that it's going to change as they are getting older, want more
Hmm.
autonomy, and then
Hmm.
those teen tween years when they're
Hmm.
really starting to need to establish good habits for
Hmm.
the rest of their lives. And as parents and doctors, caregivers, this is a great time to have those healthy conversations. And we can
Amazing.
we can talk about basic skincare. We can talk about sun protection. We can talk about
Hmm.
all of those things,
Hmm.
as a way to lay down a great foundation.
Oh, that's amazing. That's amazing. And also, I think my next question, aligns up really well with your project because, how does all these things fit into their future mental health and their well-being as adults?
Oh, that's a great question, because you know what? There's really well established relationships between any type of skin
Hmm.
problem, inflammatory skin diseases, of which acne is one,
Right.
and mental health struggles like depression and anxiety. So there is a strong relationship.
Hmm.
So the tools we give now in terms of self-care, positive body image, all of those things are really important to
Hmm.
hold our teens in good stead and make sure that we're looking out for signs that they might be getting down, or, if, for example, your teenager is struggling with more severe acne and the
Hmm.
tools you're finding over the counter aren't
Hmm.
really helping,
Right.
that's a time to say, you know what? If you've got really significant acne with early scarring, it might be time to see our doctor, and
Hmm.
opening up that conversation by relating it to you. You know what? I struggled as a teen.
Hmm.
Let's talk about what we can do together. That
Right.
first step might be you go to the drugstore, you go to one of
Hmm.
the retailers to look for some over the counter options. But
Right.
if that's not cutting it,
Hmm.
seeing a doctor, your pediatrician or a board
Hmm.
certified dermatologist or pediatric dermatologist
Hmm.
can really help them get the care they need,
Hmm.
because we don't want to underestimate or minimize or stigmatize the idea that inflammatory skin problems affect mental health. They 100% do.
Fantastic. And I guess through addressing that, we can also fix the issue with the resilience, maybe.
Oh, yes, absolutely.
Hmm.
That that idea that we can empower our teens to take
Mm-hmm.
good care of themselves really
Right.
establishes that
Mm-hmm.
basic, resilience, I think.
Right.
And I mean, we've kind of, as a society, normalized that for girls and
Mm-hmm.
self-care. And
Right.
so let's now do it for our boys.
Mm-hmm. Thank you, thank you. You know, so what insights, from your practice, about boys that make them resist this, because sometimes, like I guess it's a peer, like peer pressure or stuff like that. So how do you address that?
I think this is a really important question because I do think that if I'm treating teens in my practice,
Mm-hmm.
the girls are more likely to follow every step and do all the things I'm asking.
Mm-hmm.
And the boys are a little less likely to comply. And I
Mm-hmm.
think there's so many reasons for that, from
Mm-hmm.
societal,
Mm-hmm.
pressures or constructs, and then maybe just the information that they're getting at home. Like if dad doesn't talk to them about these things, maybe they think, oh, I should be quiet about it and
Mm-hmm.
not really, bring it up, or I should be embarrassed. But we want to break down those barriers. So a lot of
Mm-hmm.
times when I'm in my practice, I'm seeing these teen boys
Mm-hmm.
come in and they're not looking at me and they're wearing their hoodie
Right.
and they're just, they're kind of, it's not really denial, but just a
Mm-hmm.
sense of maybe powerlessness, that
Mm-hmm.
they can't do anything about it and they
Mm-hmm.
shouldn't care. But
Mm-hmm.
you know what? We know boys do care. They
Right.
care a lot.
Mm-hmm.
And so it's up to us to draw them out, to tell them this is totally normal. Here are the
Mm-hmm.
steps.
Right.
I think making it more simple to start
Mm-hmm.
with at least is good because,
Mm-hmm.
unlike these Sephora baby girls who are going to do
Mm-hmm.
a 20-step regimen, I think, 2 or 3 steps is really adequate, and
Okay.
trying to tailor it to what
Mm-hmm.
you can achieve with your son, or in my case, my patients.
Mm-hmm.
Um, but there's so much room in there to have such great conversations, healthy conversations, and really flip it to
Mm-hmm.
become a positive thing. Look at you. You
Mm-hmm.
got up, you washed your face. You did
Mm-hmm.
something good for yourself today. You did something healthy for your skin today. That
Mm-hmm.
must make you feel like really proud, like you're
Mm-hmm.
taking care of things good for you.
There you go. There you go. And also, like you mentioned, dads, we need to be more aware, and knowledgeable about the situation, so we can be encouraging to our sons, to do, to
I
make it a
hope so.
normal
That's
thing.
one goal that I have, to, especially with
Yeah.
dads that are listening to your amazing podcast,
Right.
take
Mm-hmm.
a look, see if you know
Mm-hmm.
what your teen is doing in the bathroom, see if you've
Mm-hmm.
got the tools that they
Right.
need to take care of themselves, because it goes a long way.
Mm-hmm.
It really does.
Oh, that's amazing. So, is there any, like routines that we can apply, us and our sons together to make it this process more fun and like useful in our daily lives?
Yeah, I love the idea of like a dad taking their
Mm-hmm.
son to the store
Mm-hmm.
and being like, okay, we're here. We're gonna establish all of these new practices. What looks good to you? Like let your kids kind of be the driver. What do you think? Like you could
Mm-hmm.
walk down, just the general gentle skincare aisle
Mm-hmm.
and just get a basic, I think a daily cleanser, a
Mm-hmm.
moisturizer, and a sunscreen. Boom. That's
Right.
really the basics. That's it. Like really it
Right.
starts all with washing your face, and
Right.
if
Right.
we can get sunscreen into there early,
Mm-hmm.
wonderful.
Mm-hmm.
But let them be the driver, see what looks good to them on the shelf, and you guys can participate together. And
Mm-hmm.
then watching you and your practices, and maybe there's like a first shaving experience or something else going
Mm-hmm.
on that you can kind of
Absolutely. Mm-hmm.
support and move together through. Those are
Okay.
great educational opportunities for dads and boys, I think.
Absolutely. Thank you. Thank you. Like you mentioned, I think this is a good example because when we do that, then we can get to educate them what is good and what is bad. Because sometimes they might be totally off or something like that. This
I
is
agree.
amazing.
And I have my opinions. I think that Axe body spray did a great job with their advertising campaign, but it's not my favorite because all of that fragrance and all that aerosolization of chemicals, like I don't want our teens,
To get used to it
exposed to
and
all of that.
right, right, absolutely. Thank you so much. And so far this whole issue with acne, this is a big roller coaster for, so how do we as parents, what tips do you have for us so we can support our kids when they have these breakouts?
Yeah, I mean, we talked about just bringing it up, normalizing it.
Hmm.
If you feel your child might be embarrassed, link
Hmm.
it to something you've done in your past. Say, hey,
Okay.
you know, I have noticed maybe a little bit of a breakout, let me tell
Hmm.
you what I did when I
Hmm.
was younger.
Right,
And
right.
boy, we've really come a long way. There's so many things that we can do, and
Hmm.
just kind of going through the same, basics that we talked about. And
Right.
that's a time to check in. Hey, are
Hmm.
you washing your face? How
Hmm.
often do you wash your face? What are you
Hmm.
washing your face with? You
Hmm.
might be surprised to find
Right.
out it's, something that you weren't expecting. But
Okay, okay.
a good way to start the conversation. And then I'll just mention too, acne looks different in different
Hmm.
skin types. And so you
Hmm.
want to be on the lookout too in different skin, a range of skin tones, like in
Right.
skin of color. You may
Hmm.
not see a lot of the redness, but more hyperpigmentation. And
Right.
that can last for a long time. So making sure that we're addressing it and treating it
Hmm.
appropriately is really important. No matter, what skin tone, what age, all of that
Hmm.
is important. And knowing that if things are looking more severe,
Hmm.
um, seeing a dermatologist or your pediatrician to start with. They're really usually great at first line. But
Hmm.
if something's severe or scarring, you want to see a board certified dermatologist.
Fantastic. Well, thank you so much. And I'm glad that we spoke about also like the issue with the sun protection. To like make sure we kind of pitch that in from the beginning
Yes.
to, this is amazing. Is there anything else that we can pay attention, like going forward in terms of the sun because many folks in the sunny states they go through this all the time.
Yeah, so sun protection is kind of like our non-negotiable. We need to be
Mm-hmm.
doing it. I would recommend that tweens and teens incorporate a
Mm-hmm.
SPF 30 or greater into their
Mm-hmm.
skincare,
Mm-hmm.
every morning. And
Mm-hmm.
then if you're out for long periods and on a day where the UV index, and you can look at the UV index on your phone on the weather
Mm-hmm.
app, and if
Okay.
it's 3 or greater, you need
Mm-hmm.
full protection. And that's a time that you will need to be reapplying. If you're outdoors for more than a couple hours, you need to reapply your sunscreen. And that's another great healthy habit and self-care habit to get
Mm-hmm.
into really early. And trust me,
Mm-hmm.
your children will thank you 20 years from now if they start,
Right.
doing regular sun protection,
Mm-hmm.
in their tweens and teens. And I also love the way that sun protective clothing has really advanced over the past 5 years.
Mm-hmm.
You can get amazing rash guards, great hats. They all look stylish. And that's
Mm-hmm.
another way to
Right.
really protect your skin well from the sun, especially if you're going to be out for a long time. A lot of teens and tweens are super active. They want to be out there if they're on the lake or they want to be on
Mm-hmm.
a beach. So
Right.
a rash guard is a great idea. Then you only need the sunscreen
Mm-hmm.
to apply on exposed
That's
areas.
it. Yeah. Amazing. Amazing. So I know we have so many questions, but I don't want to keep you for a long time. Can you share a little bit about Strike Club? Because what's the mission and what's the philosophy behind it?
Thank you. Yeah, so Strike Club is my company that I had mentioned earlier in our
Mm-hmm.
chat. It's a personal care and hygiene brand aimed for boys with an eye
Mm-hmm.
on acne because certainly 90% of us get acne, and it's something that I think we haven't done well for our boys. And we
Mm-hmm.
founded it for moms back in 2020, and we had been looking for products for our own teens, who
Right.
were struggling. But
Mm-hmm.
when we came, to the shelves at the drugstores and the big retailers, we were finding ourselves empty. All that we saw were pink, fruity, products designed for
Mm-hmm.
sure, like with an eye on girls
Mm-hmm.
and marketed to girls,
Right.
or the like old medicinal things from the 1980s and 90s that I
Right.
used myself, like
Right.
Clearasil and things like
Right.
they're still there.
Mm-hmm.
There's really been a lack of innovation. And in my practice, I have had a lot of luck with one ingredient that's a little bit novel and
Mm-hmm.
innovative to use for acne. It helps to
Okay.
reduce bacteria on the skin, and it's,
Mm-hmm.
helps with inflammation, but it's really gentle. So it won't,
Amazing.
strip or dry or bleach your towels. And so
Mm-hmm.
that's really our hero ingredient. And we include it in most of our products, but we thoughtfully design the line to fit easily into a busy teen life. Like one wash head to toe, you're done.
Mm-hmm.
Wipes that you can throw in your backpack that fight bacteria on the skin that you can use, to wipe your face and then maybe your sports equipment. So
Right.
it's really just a lot of thought about how that product is going to be used. And we really, that's the goal. We want them to use it because
Right.
nothing will work if it just sits on the counter for
Absolutely.
for months at a time. So
Right.
that's the Straight Club mission, to take away the stigma surrounding self-care for boys and
Mm-hmm.
empower them with the tools they need to get great hygiene habits early.
Fantastic. Well, thank you so much. Do you have any questions for our future guests as dads? Just in general, from your experience, you would like to for that question to be addressed by dads?
Oh my gosh, I am just so glad to even have the opportunity in your platform to be
Hmm.
speaking directly to dads. I mean, this is
Hmm.
just an amazing thing. And I
Hmm.
would say to all the dads out there, don't be shy about this topic.
Hmm.
Really dive in, ask your kids, go and do the things we talked about. If you're noticing any skin issues, bring
Hmm.
them to the store. Use it as a time to bond and set a good example for your teens. And certainly if dads have any questions or want to get in touch with me, I am on
Hmm.
social media. I'm on Instagram and TikTok,
Hmm.
really available. I think it's really important, this relationship with dads and their sons, and
Hmm.
I'm just really excited to have this opportunity to talk to you about it.
Fantastic. Well, thank you so much. Really, our talk today has been really incredibly insightful, and it's been fantastic. The conversation, and I'm sure dads and moms definitely they'll enjoy this and have fun raising healthy and confident kids. So thank you so much, Dr. McGuinness, for joining us today.
Oh,
Th-
thank you so much,
Thank
Suleiman.
you. Thank you. Thank
Thank
you.
you.